Assalamu alaikum. Uh, Today, I would like to take a sneak peek over many aspects of public health, especially the definitions. And I would like to go through many definitions of public health. All of them definitely are pouring in same river of the concepts of public health. As all of us know, the public health is a science of, as all of us know, it is a science of protecting and improving the health of people and their communities that's achieved by promoting healthy lifestyles, researching disease and injury prevention, as well as detection and preventing and responding to infectious diseases. This is not my definition, it's the definition of CDC. So, overall, public health is concerned with protecting the health of entire population. These populations can be as small as a local neighborhood, small community, or as big as an entire country or even a region of the world. So, public health professionals try or are trying to prevent problems from happening or recurring through many ways, through implementing educational programs or recommending policies or even administering services and conducting researches as we do. In contrast to clinical professionals like doctors and nurses who focus primarily on treating individuals after they become sick or injured, there is a discrepancy in between both. Public health also works to limit health disparities. A large part of public health is promoting healthcare equity and equality and accessibility. Uh, let's start with a case study of diarrhea. I would like to go through unusual way of discussing the different scopes of public health. I will start by case study of diarrhea. To reach by the end or to reach ultimately to the concepts of community and public health and population health and whatever we are discussing. So, uh, this is a young girl living in a very poor community. Her name is Babita. She's around 2 years age or 2 years old. Uh, she has a frequent diarrhea with a frequency, let's say, 10 or 15 times a day. Okay. She has been complaining of vomiting with frequency also 5, 10, or wherever. She has proved signs of dehydration like eye globes, sunken eye globes, dehydration, slow respiratory rate, rapid pulse rate, blood pressure is very low, stool analysis, many pictures of gastroenteritis. We have done stool analysis and we found bacteria wherever is that bacteria. Serum electrolytes are very low, and definitely as physicians, we are trying to rehydrate. We had tried to rehydrate that girl for many days, but unfortunately, she died. Unfortunately, Babita died. The problem is very broad. This is a very poor, large family that has 8 siblings. The problem or the disaster here is the grandmother told the mother not to feed her child during diarrhea. This is a disaster, as all of us know. Uh, Beside no health facility in their village, mother couldn't go in night and had to look after other children. Other problem is her husband is always or almost always drunken. Mother walks or has had to walk to nearby hospital 10 kilometers away. Very bad circumstances. Can you imagine what circumstances are around that case? The question now, was the death of Babita preventable? Could we prevent the death of that girl? Yes. The answer here is yes. Let's discuss the different circumstances around or surrounding that case. The question, our role in the health system, first we have asked ourselves, was the death preventable? We answered yes. The second question, our role in the health system, I mean here, our all, the surrounding circumstances that lie behind the death of that girl are lying in health system. The main factor, as we see, is or was lack of care. Lack of care. Okay? Why? Lack of care, first, because no family support. It was a very large family with 8 or 9 siblings. Many siblings, as I have said right now. No medical facility. Wrong cultural beliefs and practices in many in many Eastern countries, definitely our communities in many Eastern countries, the female child is very bad. They consider it a bad omen. This is another cause of lack of care for that girl. Poor hygiene, definitely with a very poor family in a very poor community with a very poor facilities, poor hygiene is essential in that case. Malnutrition, definitely, it's another factor that lie behind the death of that girl. Although all those factors can or can be accounted on the biomedical concept. But the answer now is the biomedical concept is that all factors lying behind the death of that girl? No. There are another factors like poverty, illiteracy, and transport. Okay, so we can easily see that inside the health system, we can see the funding or the factors that lie behind the death of that girl. No family support, many siblings, no medical facility. All of those factors have led to lack of care. Other factors or other side, wrong cultural beliefs and practices, considering the female child as a stigma, poor hygiene, malnutrition, all of those factors are lying in the biomedical concept. Other factors can lie behind the death of that girl, which are not belonging to the medical or biomedical systems, which are poverty, illiteracy, and transport. Okay, we have three concepts of disease causation. Each concept or each version has been adopted by certain person. The first one is the traditional biomedical concept. This is a disease caused due to presence of causative agents, salmonella, shigella, bacteria, virus, fungi, or whatever, basis in germ theory of disease. Definitely, this concept or this vision is adopted by physicians. Okay. Second concept or second vision is the socio-epidemiological concept. Here we can say that the causative agents alone may or may not be sufficient for disease occurrence. We have abreast with those factors social factors which are important in the disease causation and progression, just like poverty, malnutrition, lack of hygiene, lack of health care, insanitary food, or whatever which is outside the health system. This is the social epidemiological concept. Definitely, usually it's adopted by socialists, which is wrong. It must be adopted by socialists as well as physicians. Okay, let's go more. The third concept is the political developmental concept. It's a comprehensive approach, puts health in the context. Really, the health is lying in the context of the problem, but beside or abreast with various political developmental situations, like effects of governmental policies, outfalls of development on disease occurrence, stems from the multifactorial causation of disease. So, For any disease to be caused, there must be traditional biological agents, wherever it's bacteria, sorry, bacteria, viral, fungal, or whatever. Social epidemiological concept, poverty, malnutrition, lack of hygiene, or whatever. The third is political developmental. I mean here the political decision behind the power or the strength or the efficacy of health services. Okay, very simply, we can take a look over the difference on in between clinical and public health. If we see that the physician is caring only about just diagnosis and treatment, this is a concept that has been adopted by clinical physicians. That's his creed. The creed of clinical physicians is usually rapid diagnosis and treatment. So the patient here is a deceased person, and I'm pressing over the word deceased person. The physician here is dealing with a deceased person. Good work for the physician means diagnosis and treatment. The end result that is looking for is cure of a patient. So it's focusing mainly on a patient's rights in diagnosis and treatment, on one patient right, only one patient right that is sleeping in front of him in the bed. The outcome is immediately obvious after treatment. Definitely after treatment, most of patients respond to the treatment. So the outcome is rapid and immediate. That gives the physician a convince or self-esteem. Uh, Point five, focusing on definitely on biology, physiology, pathology, radiology, whatever. The physicians usually love to talk about controlled double-blind clinical trials, like, for example, what we are discussing between each other. I have faced today some patient with was very difficult in treatment. I gave him so and so and so and so, and after many days he came back to my clinic. He is very well now. He responded very well to my treatment. I'm proud of myself because I have achieved a rapid outcome with only one patient that I'm only concerned with his rights in diagnosis and treatment. I gave him proper diagnosis and proper treatment. So this is good work for me. On the other side of the story, our patient in the public health, our patient is the community, not only one person. So our patient is a community, not a person, not a single person. Our patient here is a community and population. Good work here means prevention, promotion, and protection from diseases, from outbreaks or epidemics. I'm focusing here mainly on human rights, not a single patient in front of me, huh? But I'm focusing here mainly on human rights and social justice. Every person must take equally, just like all other persons, and even environmental justice. The outcome immediately, not immediately, the immediate outcome was the clinical physicians. He gave treatment, diagnosed and treated the person. The outcome was achieved after a few days. But the outcome here, because I'm dealing with community, with environment, with a lot of people, I'm dealing with a population. So the outcome is not immediately obvious, but long term. It may be apparent after weeks or after months or even after years. Here I'm not dealing in public health or community health or community medicine. I'm not dealing with physiology or pathology or whatever, but I'm dealing with sociology, epidemiology, cultural anthropology, economics. This is in the other side of this. So if we discuss the difference between public health model and medical model, We can find that in public health, the location of health action is the community, where in clinical medicine, it's in health facility, in hospital or in clinic. The time scale of action is long term. As I told you before, it may take weeks or months or even years, but the result or the outcome in clinical medicine is immediate. Sector is multi-sectorial or multi-sectoral in public health, where in clinical medicine it's in health sector. The focus of attention in public health is the population, but in clinical medicine is just only one individual, one by one. Sorry. The principal objective, disease prevention, protection, control, but in clinical medicine, diagnosis and treatment, which is management. Visibility of results immediately in clinical medicine, where it's delayed in the public health. So the visibility of results in public health is low. Nothing obvious happens for individuals, and even the outcome usually appear after weeks or months. But in clinical medicine, the visibility of results is very high. Okay, the consequences for profile in financing in public health is very low, where in clinical medicine is very high. Stats among doctors low, although it's high in clinical medicine. Profile in politics, public, and media low, where it's high in clinical medicine. This reflects how strongly the community, the policies, and even the policymakers are usually interested in clinical medicine and controversy with public health, which is very bad again. So now we can find that it's outspoken differences and clear gap in beliefs and actions that should be minded in between clinical physician and public health physician. We can uh, figure out that the clear differences in between both might be due to vision, differences in vision, differences in mission, values, focus, scale, ethics, even education and nature of science and training in both fields. Definitely, it's clear that all of those factors are different in between both scope of actions. The question now, how can we bridge that gap in between both scopes? We must enhance, first, we must enhance the understanding of public health principles among whom? Among physicians in the clinical field, and clinical medicine principles among public health physicians. So we must enhance both of them to understand the scope of action of the other side. So we must enhance understanding public health principles among physicians, and we must enhance clinical medicine principles among public health physicians. So bridging the gap happens also or must happen in research. We have to expand our research portfolio to focus on health disparities and other population level research, and bridging even the gap will not be successful unless we translate what we learn in research all the way into the public policy. I hope it's clear. Now, it's sense making. Uh, we can see that improving health outcomes in any community requires more than just medical health services. Again, improving health outcomes in any community requires more than just medical health services. It's not just only lab and medications. We need a new level of insight into all factors that contribute to a person's health. It's not just only bacteria or fungus or virus or whatever as biological factors. We have to figure out that there have been many health determinants outside the health system. So we must address, to make it clear, we must address all those factors rather than simply treating symptoms. What about those factors? Might be personal factors, individual lifestyle factors, smoking, alcohol drinking, or whatever. There are socioeconomic, cultural, and environmental conditions. What do I eat? What do I drink? What about the fresh air? Do I have a work or am I unemployed? What about living conditions in my house? Is fresh air coming into my house? Many factors as health determinants. So care is not just medicine. Again, care is not just medicine, but the food we eat, the water we drink, the air we breathe, and services that play a role in holistic health programs must include other programs like nutritional counseling, exercise programs, smoking quitting programs, alcohol quitting programs, many other programs not focusing on biological factors. Uh, so, frankly speaking, outspoken, the future of health care will be a world away from the current system that typically treats people only after becoming sick. Doctors will diagnose a person's risk factors for many chronic health issues by evaluating genetics, lifestyle, environmental factors, or even social circumstances. Then providers will create a comprehensive care plan that's supported by a care manager within the person's community. Those care managers will be long-term partners, providing support between doctors, visits, and connecting people with the local services that help them to live happier, healthier, and so on. So again, the future of health care is not just only diagnosis and treatment. It will be another world away from that we are living now, which is typical treat people only after becoming sick. We don't have to wait for people to become sick and look for treating them. No, the picture now is completely different. That's why a new clinical branch that has been added to or for the study of public health in George Washington University School of Medicine, Health Sciences, and University of Toronto, and some other universities all over the world. Such courses or curricula have been designed to prepare future clinicians to assume their role in 21st century health system. Uh, this is a clinical public health curricula which was established or were established by many schools of public health. Uh, Clinical public health curricula integrate the following into the medical education throughout students' medical education from the start. Public health, social determinants of health, community and population health, health system organization and management, healthcare policy, prevention and health promotion, evidence-based practice, community service and engagement, interprofessional teamwork, clinical advocacy, and leadership skills. The trained physician in clinical public health branch will not only be excellent clinicians for individual patients' health needs, but they will also be able to identify, understand, and address the community health issues, both within and beyond the walls of the clinic. So he will adopt approaches of public health abreast with the clinical medicine. Uh, That's why, because both branches are beneficial to each other. I mean here, benefits of public health for clinical medicine and the benefit of clinical medicine for the public health. Okay, now very rapidly to take a sneak peek over the definitions of all of us know that public health is a science and art of preventing diseases, prolonging life, promoting health, I didn't add anything new for you. Public health is what we do together as a society to ensure the conditions in which everyone can be healthy, everyone matters, everything matters. Again, everyone matters, including all the community members, and everything matters, not only biological factors, not but social, mental, economic, political, as we have discussed before. Public health promotes and protects the health of people and the communities where they live, where they learn, where they work, where they play. So public health services must exist in my home, my company, my clinic, the street, my factory, my club, everywhere. Trends to be focused. The public health is adopting trends to be focused on creating conditions in which individuals can be healthy everywhere, as discussed before, for everyone, as discussed before. So, focusing primarily on large scale concerns or threats, just like vaccination, all of us know that vaccination, disease prevention and combating, education, air quality, water quality, injury and illness, healthy behaviors, minimizing outbreaks, using what tools? Using education, using policy making, using researches for disease and injury prevention. I'm reviewing with you the information that I'm sure that all of you know. But now, I have a new term, community health. What's community health? It is the health states of people sharing same community in a somewhat localized geographical area. Such population in such localized community are living under same general regulations, same norms and values, under same organizations where the government is responsible for providing everything. Like what? Like housing, like water and food sanitation, like agriculture and food production, living and working conditions, employment, education, everything the government is responsible. Healthcare services. This is the community health. So it's the health states of people sharing same community in a somewhat localized area under same norms, same values, same general regulation, same laws, same organization, and so on. The community health addresses the social and economic determinants of health opposed with the biological determinants or the other factors side by side. So, social and economic determinants are very important part in the practice of community health. So, community health is mainly addressing the social and economic determinants of health in somewhat localized area under the collection of social and economic circumstances that can prevent people from attaining and maintaining positive health outcomes. So, using the tools of caring about the social and economic determinants, they keep people healthy and helping them to maintain and attain positive health outcomes. So community health is similar to public health practice, but tends to be more strictly geographically based, as we have mentioned before, and has been adopting the holistic vision to healthy living, including the social and economic factor. So community health often tackles a broad spectrum of issues such as influencing public policy and creating shared community resources. Community medicine, the emphasis in community medicine is on the early diagnosis of disease using screening, the recognition of environmental and occupational hazards to good health, and the prevention of disease in the community. So, provides comprehensive health services ranging from preventive services, promotive services, curative services, and rehabilitative services. Uh, Now we are coming to a new title, which is population health. We have discussed public health, we have discussed community health. Now, we been discussing population health. It's an interdisciplinary, customizable approach that allows health departments to connect practice to policy for change to happen locally. What does it mean? It means that population health brings significant health concerns into focus and addresses ways that resources can be allocated to overcome the problems that drive poor health conditions in the population. This approach utilizes non-traditional partnerships among different sectors of the community, like public health, like industry, academia, healthcare, local government entities, to achieve positive health outcomes. Uh, Population health is about creating a collective sense of responsibility. It advises, it recommends that every partnership or shareholder in the community must have his own responsibility. So, population health is about creating a collective sense for all of carrying his own responsibility across many organizations and individuals, in addition to public health specialists. So, it connects the community, the organization, and the population together to advise and to recommend each one of them to carry or to advocate his own responsibility. How is population health different from public health? Public health, as we know before, the public health works to protect and improve the health of communities through policy recommendations, health education, outreach services, and research. As we know, it can be defined as what we as society do collectively to assure the conditions in which people can be healthy. Sorry for that sign. But on the other hand, population health provides an opportunity for healthcare system, agencies, organizations to work together. It supports, it advises, it helps the cooperation and collaboration between all the community sectors, how they have to act together in order to improve the health outcomes of the communities they serve. Uh, so, as we see, it's a sense making that population health is requiring unanimous cooperation and coordination and collaboration in between all the community services providers, either governmental and even the non governmental agencies. As we see, it's irrefutable that the health of the community is the responsibility of all. We can easily find across the net police is responsible for population health, community centers, churches, health departments, mosques, parks, transportation, fire departments, hospitals. What else? Doctors, nurses, and mental health employers, many economic developments. It's a great net. All of them are responsible for what's known as population health. Uh, Again, a new title, Global Public Health. What's global public health? Uh, in the age of globalization, global public health is one of the foremost challenges facing humanity. Definitely not any one nation, not any one coalition, not any one nation, but all of humanity. That's because global health is not just the work of massive governmental agencies or international global health organizations, but even also of people and communities, doctors, nurses, educators, volunteers, and advocates. Fighting diseases and spreading health throughout the world is one of the most important missions the human race can undertake in 21st century. And with modern medicine, communication, and technology, it's within our reach. So, we can brief as a result of globalization, hazards that may affect public health can come from outside state boundaries. Public health work now should require attention to cross-border health risks, and all of you are living right now across a global disaster. COVID-19, including access of infection, dangerous products, environmental products, and traveling the infections and dangerous products and environmental pollution across the border are now very easy during the globalization. Now, a new great title that sounds tremendous. One health, one planet, one future. If we figure out that human population are growing and expanding into the new geographical areas, as a result, more people are living now in close contact with wild and domestic animals, both livestock and pets. Animals play an important role in every part of our lives, with our food, water, travel, sport, everywhere. So definitely, close contact with animals and their environments can easily provide more opportunities for diseases to pass between animals and people. Yes, it's clear. Uh, the Earth has experienced changes in climate and land use, such as, for example, deforestation and intensive farming practices, global warming, disruptions. Such disruptions in environmental conditions and habitats can also provide new opportunities for diseases to pass to animals, then right to us. The movement of people, animals, and animal products has increased also from international travel and trade due to globalization, as all of us know. As a result, uh, the diseases can spread quickly across borders, transborders, and around the globe. So, One Health is a collaborative, multisectoral, and transdisciplinary approach. Again, One Health is a collaborative, multisectoral, and transdisciplinary approach, working at the local, at the regional, at the national, and the global levels. This is One Health, with the goal of what? Of achieving optimal health outcomes, recognizing the interconnection between people, between animals, and between people, animals, and plants, between people and plants, between animals and plants, between sorry. أنا آسف لأن كان جالي تليفون. Again, so One Health is an approach that recognizes the health or recognizes that the health of people is closely connected to every single part living with him on the globe, wherever he is or wherever it is, animal or plant or rock or water, river or whatever. All of them are linked together. One Health is not new. It has become more important in so many recent years. This is because many factors have changed the interactions between people, animals, as I have said before, animals, plants, and our environments. I believe this is the end. Lastly, a question. How should we think? Should we think community health or community medicine or public health or population health or clinical medicine or One Health? Modern public health, finally, is concerned with threats. Modern public health is concerned with threats to the overall health of community, so addressing the determinants of health across population before starting to diagnose or treatment, rather than what? Rather than advocating for individual behavior change. يعني أتمنى إن المحاضرة تكون كانت شيقة، ما كانتش مملة. يعني أنا حبيت إن أنا أستعرض معاكم موضوع جديد بالنسبة لكم مش متعودين عليه مني. أنا دايما بكلمكم على الأوكيبيشنال ميديسن، فأنا حبيت إن أنا أتكلم على البابليك هيلث لأنه فعلا موضوع في منتهى الأهمية. تمنياتي لكم بكل التوفيق.